Good afternoon. Hi, everyone. Greg Silverman, CEO of the West Side Campaign Against Hunger. Uh, Thanks for joining us. Hopefully, it's a nice, healthy Friday lunch hour for those of you on the East Coast. Uh, and we are thankful to have you here for our town hall. Just for a little background, I'm Greg. I'm the CEO of the West Side Campaign Against Hunger. For those of you who don't know, we're an emergency food provider providing food to about 80,000 New Yorkers in need, healthy, mostly fresh produce uh, for all of our customers, as well as benefits enrollment for each and every customer we serve. At the same time, we work with a lot of other emergency food providers on the front line through our roundtable initiative, a collective effort with other emergency food providers to make sure we're getting the best prices for all of our customers and for all of the organizations, and also that we're advancing the needs of the front line in fighting hunger, because that's where we sit each and every day. Just for a bit of overview of today, right? Like in the pandemic, as many of you know, we were in a lot of isolation for a lot of different reasons, and that had negative consequences and sometimes positive. One of the positives is we built out these town halls, an opportunity to tell the story of WSCAH, but more so tell the story of what's happening in communities in our city and beyond. And so we do these a few times a year to sort of bring in really amazing people to speak about their sort of vantage point on what's happening, especially in hunger. And so today we want to take a really macro lens and look at things not just from the New York City perspective, but also the national perspective and international. So, truthfully, when I my background's as a chef restaurant owner. When I left the restaurant industry in 2008, sold my restaurants, I moved to England from Ithaca, and I wanted to focus on really transforming our food sector, right, from a lens of hunger, from a lens of anti-obesity, public health, and I knew one of the main things to do was not just to do more to help, just to be a helper, but also to learn more. And so I spent a couple years at the Center for Food Policy at City University of London, under the amazing leadership of the professors there, including who I'm so excited to have with us today, Professor Martin Caraher, who is one of my professors and mentors, and I've been in touch with for the last decade or so. So we're super thankful he was able to join us this later afternoon from his London time. And so I want to pull on Martin, and then we'll bring on Chris Costanzo as well, who is the founder of Food Bank News. And so I'll turn it over to Martin as soon as his video comes on. So welcome, Martin.
Hi, everybody. Thanks, Greg. Thanks for the invitation and the welcome. It's nice to be here. I'm Professor Emeritus at City University in London, which means I'm retired and I can do what I want to do rather than what the university want me to do. And I don't have to fill in lots of forms, which is the beauty of being retired. The background to this is we have an edited book with other colleagues, of which Greg has a chapter, in which we give you access to later. We'll put it in the chat. You can download some chapters from the book, not all of the chapters. If you want to contribute to my retirement fund, the book is about £150, which is over $200. But you're welcome to download some of the free chapters. Feel free to do that. And it's really nice to be here, and I'm looking forward to a good conversation. We'll draw on the book, but as Greg says, we'll also draw on other experiences, I think, here in London and more widely in the US. Thank you.
And let's pull on Chris Costanzo as
Here we go. Hey, everyone. I'm Chris Costanzo. I'm the founder and editor of Food Bank News. That's a publication that goes specifically to people who work at food banks all over the country, and in fact, increasingly all over the world as well. Food Bank News started about 5 years ago. I was actually volunteering at my local food pantry here in South Orange, New Jersey. I thought it was a really neat little operation, so I wrote a story about it for our local community magazine, because I'm a freelance writer. And From there, I got involved in a larger organization here in New Jersey called MEND, and that's an organization of about 20 food pantries that comes together every month or so, and they share they share what's going on in their food pantry. They trade ideas about helpful hints about how to solve problems. They have speakers come in and speak to them. And as I started attending these meetings and hearing about what was going on at the pantry level, I thought that the information that they were sharing would be great to share more widely to anyone who was running a food pantry or a food hunger relief organization anywhere. So I actually left that first meeting and I went to GoDaddy, which is the organization that hands out, web addresses, and I tried to see if there was any publication or any website out there that was addressing the specific population. Nobody was, so I bought that URL and I started writing stories about food banking. And I come from a background of trade magazine publishing, and I know that there's a trade magazine for every single thing you could possibly imagine. There's something called pet food processing. There's something called broom, brush, and mop. So I was really shocked to realize that there was nothing out there to serve this this sector of the food system that is trying to really help a very broad part of our population, which is the 40 million people in America who are food insecure. So it's been around for about 5 years. We've been writing stories about best practices in hunger relief for people who work at food banks and food pantries for those years. And it's been a fascinating, fascinating topic. So what we're going to do here today is take a very interesting walk, I think, around the charitable food systems of different countries. I think it's going to be interesting to see how different cultures, histories, government practices, food supplies impact the population of food insecure people in different places. And why don't we start with a very broad question? Where are we today in terms of feeding people in need in both the US and the UK? And how did we get here?
I mean, I guess I can start from here. I'm sitting here in Washington Heights. I can start in New York City. And maybe I'll start back again at the pandemic in some ways. Like where we're at right now is continued failure. We actually did some amazing work, I'd say, in the United States during the pandemic when things were at some of the most difficult times. We expanded, pandemic EBT, we earned income tax credit, child tax credit. We expanded a super meager safety net and made it actually something that would noticeably and actually technically it decreased food insecurity in many people, especially children. It worked. And so we, of course, got rid of that when the technical pandemic ended. And we've seen a subsequent explosion in need across the country. At WSCAH, for example, we're at our original site at 86th Street. Our numbers are up 65% the first half of our last financial year compared to the height of the pandemic, which was the busiest time in our history. So we've never served this many people. And so that's where we're at today. But I'll let Martin maybe speak from across the pond.
Yeah, I mean, it's pretty similar and pretty dire here. We're seeing increased need. There were many problems with the pandemic, but there were also many good things about it, that people help, communities helping themselves, government actually coming in and doing something around food insecurity. But we've just got figures today, and I'll put it in the chat, that 300,000 children have gone into absolute poverty, 50% of median income in the last year. So that means we got 4 million children in poverty and 12 million people in the UK in poverty. And that has a direct bearing on food access and the dependency on food banks, because what's happening here is an austerity program cutting back on our social welfare. Our social protection mechanisms are shot to hell. So we've got our main social protection program is called Universal Credit. And actually, you can't eat a healthy diet on universal credit. It's practically impossible to afford a healthy diet. we also had another report this morning saying that 6 out of 10 nurses, the nurses are not, not well paid, but not badly paid, are now using credit cards to cover their living costs, including food. And food banks are being set up in hospitals and other public institutions to deal with public sector people who haven't got enough money to be able to afford a healthy diet. Just very quickly, during the pandemic, the only country that managed to reduce by a very small margin, 0.3%, its childhood food insecurity was the US. And that was because of cash stimulus packages, not because of food parcels or food pantries, but giving people cash. I mean, it's a very small percentage, but everybody else in the world, their food insecurity increased. You at least held it reasonably steady and even decreased it a very slight amount.
Yeah, that's true. And then that all ended at the end of the pandemic.
Yes.
And now
Yes.
we're back to this idea of having to convince individual states to get those benefits back out there for children.
Yeah.
One thing that I think is really interesting in terms of the differences between the US and the UK is that in the US, we have a program, a relief program that specifically goes to food, the SNAP program. And I don't believe that there's anything equivalent in the UK. And maybe we can talk a little bit about, the type of government assistance that bubbles up in these different societies.
We don't have anything equivalent to SNAP. We have something on a much smaller scale equivalent to WIC, which is called Healthy Start, but it's the equivalent of buying 3 pints of milk a week. That's what the benefit equates to roughly in real terms. It's very small. It's means tested. It's not universal. It was universal, but they've cut back on it, and you can get vitamins on it. It's not controlled by our welfare department, but by our health department, because it's seen not as a welfare program, but as a supplemental nutrition program. Hence, it hasn't got the same level of cuts that our general welfare programs have, but in real terms, it's pretty tiny. It's nothing compared to WIC.
Mm-hmm. Right. And WIC being the Women, Infant, and Children, beneficiary fund that goes to pregnant women, and I believe infants, and then children up to, I think, age 5 are able to apply for that benefit in the US. And then, and in the US, maybe Greg, you can speak to our SNAP program, which is pretty unique, I think, in the world, in that it's specifically just for food, separate from any sort of like general welfare payment that you get that would enable you to pay, just have money for anything.
Yeah, it's interesting. In the US, we think of it as this program that's not restrictive, but it's in some places it's really restrictive, right? It's only for food, and it's not even you can't buy a rotisserie chicken, right? You can only buy a raw chicken, because people in need, obviously, from this government oversight perspective, are like, have the time to always have the time to cook, right? Which is just this strange fallacy. Instead of giving folks who are working oftentimes multiple part-time jobs on or off the books, conveniences that would allow them to flourish in some way. So, it's restrictive to foods. You can't, go out and buy things outside of that realm where what your needs might be, whether it's clothing or whatever your family needs. And WIC is obviously even more restrictive, really focused on giving the sort of very similar to what Martin was speaking about in the UK, like items that really help the health and well-being of the mom and her newborn children. But SNAP, one of the things we saw in the pandemic again was opening, SNAP funding, SNAP dollars in the summers, pandemic EBT, getting more dollars directly to more people so they can use these funds, is a good example of, do we want people to get summer meals related to school food, or do we want to give people cash so they can actually buy the food that they want? And I think that's the choice level. It's what we at WSCAH have always been focused on the ground in our food distribution, giving people choice and the dignity to make the choices they want to make, whether that's picking kale or collards, or whether it's where, when, how you get your food. Like, these are all important decisions. And I think the more we can expand things like SNAP so that people have more choices, whether it's choice also means with more cash, right? The program is underfunded still. And there's push to get some extra money from the state, at least in New York, related to SNAP to sort of bolster the numbers. But, we're still way behind in what the amount should be. It's not, this isn't people living in luxury. This is just giving a little bit of a handout to families in need. So we continue to, backpedal. I'd say there was if folks saw about a month ago, there was worries about the budget and the funding for WIC, and there was going to be this sort of back and forth deal behind the scenes to do some pilots into restricting SNAP even further. And luckily, it didn't go through, and the money was given federally for the WIC program. But these are the sort of trade-offs that are, sort of being played around with in Washington that are very scary things to play around with, like giving people the opportunity to figure out how to feed their own families instead of telling people what to do. And truthfully, one other thing I would add is, like, let's remember, like, SNAP dollars are spent in people's communities. This is direct stimulus, not just to the families, but to the economy of local economies. Grocery stores, bodegas, all these groups gain greatly by seeing SNAP dollars push through. So it's not just, this is an amazing program that is multiple wins across society.
I mean, there are other programs such as Brazil and I would think South Africa who've got good social protection, although even as we speak, they're coming under threat because of austerity. And we have seen places like Colombia develop their programs, partially out of COVID, but also I think partially because there have been changes in political regimes. Brazil is a case and example. It had really good social protection. The previous Prime Minister, Bolsonaro, withdrew a lot of those, but he didn't dismantle it. There was too much to dismantle, but he did dismantle parts of it. And now the current Prime Minister or president is reinstalling a lot of it. So and partly that came from lessons learned during COVID lockdown, that, we need to protect people. This is good for health. As Greg says, this is good for the economy because people spend locally.
The one thing that I think is interesting about SNAP is, you are restricted in a lot of ways. You can't buy that hot meal. It has to be cold food purchases. But in other ways, it's very, there are a lot of choices that people can have. And one of the controversial things is that you can buy food that's not really that nutritious. You can buy soda with your SNAP dollars. And there is a lot of back and forth about, well, should we be allowing people, if it's a supplemental nutrition program, should we be allowing people to buy things like soda, which really do not contribute at all to anyone's health? And I'm just wondering if anyone's got any opinions on that little topic.
I guess as a chef, it's interesting. I used to help run what used to be a great program called Cooking Matters across the country, ran grocery store tours. And I remember being in LA running a grocery store tour with a group of WIC moms. And in the tour, they learn about some healthy shopping techniques. And at the end of the tour, they're given a gift card to practice what they learned and buy some healthy food for the family. And get through to the checkout aisle, we all look at what everyone bought, and we sort of are cheering for each other. What'd you buy? And this one of the moms comes through, and she's got soda, and she's got Duncan Hines frosting mix, and she's got a cake mix, and everyone's like, "What are you doing? You didn't learn." She's like, "It's my kid's birthday." I want to be like, I'm making a choice. And what's a more powerful choice than, like, there's sometimes foods, and if we want to talk about sugar and these kind of restrictions, I'd go way upstream, and these kind of things, putting it on consumers and people in need as like the enemy is wrong. It's like we can look way up the chain to the corporate interests, and that's where the levers have to be pulled.
Yeah, I mean, I would say it's dignity and trust. You've got to trust people, and mostly, they'll spend that money correctly. And as Greg says, okay, occasions, what's wrong with that? The bigger thing is upstream for me is the links with, certainly in the UK, the links with the food bank, food system, and the unhealthy food commodity industries who dump their food on the food bank. So therefore, what's on offer is sugary drinks, is high fat, salt and sugar goods, is ultra processed foods. Mostly our food, we don't have food pantries like you do. Mostly we have mainly food banks giving out food parcels, which are largely consisting of processed food. Only our very big food banks here do, as Greg does, fresh food because they're operating out of the back of a church hall with no facilities once a week. So storage is a problem. So they do rely on ultra processed food. I realize why that is. In Brazil, they have standards for food. They have nutrition standards for food banks. If you take government money, you have to meet certain nutrition standards. That doesn't mean you can't have sugary drinks on offer, but they must form part of a bigger offer. So it's regulated. I'm a fan of regulation, but I'm also a fan of dignity. And people should have dignity, and we should trust people to spend their money wisely. And mostly they do, I think.
Yeah.
I think I just say like it's where my when Martin and so thankfully asked me to write a chapter for the book he edited and just sort of telling the story that I've seen on the ground here in New York. And it starts with one of the things, my early lessons. I just finished up probably just a couple years before my master's. And so the Martin and Tim Lang and the others are, words are in my head all the time about thinking about how we should be doing this work, and my time in Washington and with Let's Move and things also in my head. And a truckload as I tell a lot of people, a truckload showed up, a donation truckload from a food bank. And my team was like, Juan came to me, was like, I don't think you're gonna like this. And I went and looked at it. I was like, this is crazy. It was hamburger helper, rice-a-roni, sugar sweetened beverages, and it was just a bunch of junk. And I put a post up on Instagram that I couldn't put in the book. Even the publishers were like, you're not going to put this picture up in this book because it shows pictures of brands that might get upset and they might sue us, right? And so I put a post up saying sometimes folks do more harm than good when they sacrifice people's health for poundage and calories. And I called up the partner and said, hey, you need to pick up this food. They're like, we don't do pickups. I'm like, I need you to pick up this food. And they're like, just give it out. We're like, no, we're not giving it out. Our team was like, no. And so I finally got in touch with the head of the organization, and she said, Greg, happy to talk to you. We haven't really met. Yeah, you've been at your job for 6 months. How about you take that post down and then we can talk? And I was like, I thought we were going to be talking about the food. You're talking about an issue with a social media post. And so that was my big learning. And I was like, and in the end, I never took the post down. They picked up the food, and we stopped getting a lot of these ultra processed foods as a penalty. And what that penalty did is it made us move from 15% fresh produce to 20 to 25% because we stopped getting this ultra processed food. Now we're at 52, 55% fresh produce. So we stopped taking the junk and started going after fresh produce with other partners, including food banks. And it totally transformed what we gave, but we had to draw that line in the sand. That was what we were told was this could upset. Like, I didn't call out the names of the brands. I didn't call out the name of the organization at all. They're like, yeah, but the picture shows this, and our partners could be upset by this who are donating the food. I'm like, my concern is our customers. My concern is not the manufacturer who's flogging some junk food and trying to, give themselves a pat in the back. And I think that is the upstream questions.
Yeah, I mean, and that leads to kind of, how did the charitable food system really come about in the US and the UK? I mean, food banks were started in the US, and I feel like they were exported to other countries, and they continue to be. But what do we know about like how the system came into being in the first place? Like, what was its reason for being? Was it to take care of this excess food? Was it to feed the people? What were the forces that were driving it to come into being in the US and then in the UK? I think there's probably different backstories there.
I mean, I think there's a lot of different narratives. I mean, I think we definitely saw, WSCAH as a food pantry, like many food pantries and many food banks all are in their mid-40s, right? They all came about around the same age, 40 to 50 years ago. Lots of struggles in the economy across the US. Folks, with good intention, I think even at a corporate level, wanting to give back and at the same time seeing, wait, from a waste perspective, like we have product we need to get rid of. We can use it in this way. You saw this the same when you had the temporary TFAT program federally. Like, okay, we want to make sure that farmers are, getting paid for the product they're growing. And if they have excess, let's buy it up and give it out. So there were these like, hey, let's connect the dots on these pieces and find smart ways to push it. But, when you sort of let things get out of control, I mean, right, like Feeding America is the largest, self-described, right, the largest nonprofit in the United States. And we haven't solved hunger. Like if you're going to tout yourself being the biggest at something, I would hope you'd want to tout as well that you're the best at this. And at the same time, we have a TFAT program at WSCAH. Actually, this is excess food across the agriculture industry gets bought up and then distributed out to the food banking sector. Like we just started refusing that food, partly because of a lot of its process, but also our customers are asked to sign an attestation that they are in poverty in order to get this food, because this food shouldn't go to anyone who's not in poverty. And we're not asking our customers these kind of questions. We ask our customers questions to help them get more benefits, but we're not going to make them feel terrible about themselves. And we're not going to track them in that way. We would never do that. So we've started refusing that food. But it's also the type of food that, a week or two after Thanksgiving, we're all getting cranberries, getting pallets of cranberries to hand out. When, okay, yeah, Thanksgiving's over. Does anyone want that? Do we want pumpkin puree 3 weeks after Thanksgiving? I mean, a little bit, but I don't think everyone wants that in their cupboard. This is like, let's just get rid of this product and incentivize producing more of it, when we need to think differently about what we're producing, right? Produce more fresh produce, produce different products that our customers and our communities need. But this is, again, back to the upstream issues.
UK is slightly different. I mean, when we go back to early 2000s, if you follow media reports, people would have to explain in a newspaper what a food bank was. By 2010, that had changed. Food banks were ubiquitous. We hit recession in 2010, 2012, between that period, and food banks grew phenomenally. We now have over 3,000 food banks in the country. The original conception was waste. That's where they originated from in the UK, but very quickly we imported the US model, and that was overlaid on the original concept of waste. Now what we're seeing is we have the food industry have cut down on waste. So food banks in the UK are now not getting enough donations either from the food leftovers from the food industry or from customers, because customers themselves in the supermarkets are feeling the pinch. They're not putting goods in the baskets to go for donations. So we're now seeing this, the main food bank providers here looking for direct cash so they can buy food. And that's a big change. I mean, as the industry gets more clever with its waste, they will cut down on waste. There'll always be some waste in the system, but they've massively, the estimates are they've probably reduced waste or surplus food by 50%. So there's less going into the food banks. The food banks are seeing an increase in demand, but haven't got the food to meet it. So they're looking for cash donations from people to serve that. So we're sort of in a real bind here about what's going on in the UK.
Yeah, I would say that similar story in the US is food banks having to purchase much more food because they want to make that healthy food. And the healthy, fresh produce is not necessarily what's being donated. So they're trying to solicit more cash donations so that you can use that cash to purchase the type of food that they want. I'm sure
and more, they're getting more donations from the government rather than that money going directly to citizens. I mean, that's that's slightly the irony that the food banks in the UK have set themselves up as doing good. They're seen as very positive. They attract money from government, which could actually go into people's own pockets to buy food, but it doesn't because we don't trust them.
Martin, what do you want to tell us about your book and what you found out when in doing the book? Some lessons that you learned globally about what's working, what's not, what are some concerns? What's the ideal combination of government assistance and charitable food assistance?
Yeah, that's a very good point. I think what we learned was a number of things. Governments initially struggled during lockdowns. A lot of the book is dealing with lockdowns, not specifically, but lockdown during COVID provided an impetus for lots of actions. In fairness, the food industry were fairly quick to react in many instances, and I'm not, I'm a critic of the food industry, but they responded in many instances much faster than government. The other thing was community responses grew up where government were failing to deliver. We see that in particularly in South America, Colombia, Brazil, South Africa. And the other thing was direct cash transfers. It was cash, give people cash, give them financial uplifts, and their health improves. I mean, that was the other thing that arose from that. The combination of there'll always be charitable responses. That's my argument isn't about charitable responses, it's about charitable responses becoming the social protection de facto. That's my agenda, that I think governments have a role in social protection, and that's not food charities have an emergency role. And with, the title of this is emergency food. That's what we're talking about. But certainly in the UK and in many countries, I've been working with colleagues in the Middle East. Food banks are now appearing in places like Saudi Arabia, United Arab Emirates. Why? I mean, we have to ask the question, why? And why are government not providing? And which segments of the population are being encouraged to use food banks? I think Brazil stands out as an example of trying to link. I don't think everything's perfect in Brazil. That's far from perfect, but they're trying to link food nutrition standards with food supply standards. If you run a food bank, you must take local food. You must have a certain percentage of local food from local farmers. You must meet certain nutrition standards, etc., etc. They've tried to link it up across the board. Whereas in other countries, what we found was silo approaches. Let's have a nutrition standard, but let's not talk to agriculture. Let's have a standard for supply, but let's not impose nutrition standards on it. So there was silo approaches to the food. But cash was the big issue I came away from the book with. Give people cash.
And that gets us to talking about how should the emergency feeding system evolve? Like, given the lessons that you've learned from sort of your global perspective of what's happening, and Greg, what we've learned from the pandemic, where should we try to steer this whole operation?
Greg, do you want to take it or will I?
Sure. I mean, I can start. I mean, I think there's a lot of lessons from the pandemic and personal to professional and etc. But we learned we can't do anything alone, right? And I think it's from the first few days. I mean, right, from figuring out where to rent a truck when we need to rent a truck 3 hours into the pandemic, to to who to collaborate with, right away. New York, we're very lucky. At the time of the beginning of the pandemic, the mayor's office of food policy was Kate McKenzie, and I think she had one colleague, and now there are thankfully at least 12. But they were on the bat phone. They were the bat phone right away. Let's think how do we collaborate? What can they get for us? How do we work directly with government? And we had built this roundtable, right, of 8 of some of the strongest emergency food providers in the city on the front lines: Met Council, Common Pantry, Project Hospitality, POTS, across all 5 boroughs. And we just shared everything. There was no secrets. There was no competition. We were let's share information so we can do our good work faster. And I think it got to purchasing, and I think you're seeing that in New York City, to Martin's point about Brazil in a way. You're seeing this sort of good food purchasing policies move into reality in New York City. Right, it's starting in I think DIFTA in one area. It'll slowly hit the whole school food, and it'll hit emergency feeding eventually. And you will join up all these forces of how you should be doing purchasing related to labor standards, related to local, related to health and wellness. Like everything will get looped in eventually. And I think it only can happen when we share data and when we work together. And what we saw was when people collaborate, we can do better work. When we get the cash we need, individuals, they thrive. When organizations get the cash they need to do great work, they thrive. Like the organizations who have become better funded and used it to like share information and do more with data, like are doing even better work across the city. You're seeing new models of distributions popping up. You're seeing, locker boxes. You're seeing different versions of mutual aid. You're seeing, mobile trucks. You're seeing home delivery. All these pieces are coming out of the pandemic. And I think it's because we collaborate. When we try to think like, I was an independent restaurant owner. And the one thing I knew is that like I had to start talking to other chefs and other restaurant owners because you get sort of caught up in your own little world and you think you're doing the best thing possible when truthfully you just don't know what's going on because you're just sort of navel gazing. And so collaboration was the biggest learning, I think, for us, and that we will never stop doing because of that. And I think that's why we do these town halls. It's why we think about the roundtable, why we built a alliance for Hunger Free New York at a state level. Like we have to share information. And anyone who doesn't want to share information, it just sends a really terrible sign.
Oh, where are we going here in the UK? Let me take that first. I think we're seeing a morphing of food banks. And as I said, our food banks don't operate like food pantries. They mainly give out food parcels. So you come along and you get a parcel of goods, which is meant to tide you over for 3 days individually or for a family. It will be scaled up. Food banks are moving towards a model, a European model of they're called social supermarkets, or sometimes they're called social and solidarity stores. And they're moving much more towards this model. And I think they've all the big food bank organizations have commissioned research on this. In many ways, they're not dissimilar to a co-op. People pay a small amount to access this social solidarity store, and they get access to food. What's different on the continent, on the European continent, is that it, particularly within the EU, the European Union, it's been funded by money from the European Union. It also links with local suppliers, local farmers, local growers. It's back to the circular economy argument, which is a major policy drive in Europe. Now, the UK has left Europe, so we're not necessarily bound by what happens in Europe. But there's a similar trend here. The food banks themselves are having to recast themselves in a different light. And that seems to be this social and solidarity store movement that they're going towards. In many ways, I think they're not that much different from co-ops. Some of them that have been set up here on a pilot basis will take maybe 200 members or 300 members because they don't want mass membership, which takes away from local shops, for example. They don't want to undercut local shops because there's no point everybody joining this if you shut local shops. And usually there's a temporary period of membership, maybe for a year, to get yourself on your feet. There are additional services offered, maybe cooking classes, etc., etc. And that seems to be the direction we're moving here. I mean, the food banks themselves realize they have a slight image problem. I think the other move that we need to be making more use of is the lobbying power of the food bank movement. There's a huge potential lobbying power. We've seen it in Canada to some extent. The Ontario group who say, I'm working for free. You can't pay me more. I want to be put out of work. Why do we need food banks? That sort of approach. But yeah, I think certainly the UK is moving that way. And it seems to me the European continent are also moving more towards social solidarity stores, but based on a closed loop economy or a circular economy argument.
Yeah, I mean, that's interesting. I think there's some small examples of that happening in the US. The solidarity store. I can think of some examples in Michigan, where it formed because the people running the pantry noticed that the people coming to the pantry, they had jobs, they had money, they just didn't have a lot of money,
Yeah.
but they needed like a low cost alternative to the regular grocery store. So they formed what they call a community food club. And I think you pay a monthly fee. I think it might be $25 or something. And
Yeah.
you can go there and every month you can get, $300 worth of groceries, but it's only going to cost you like $75 or something. And so they're creating a community. It's a membership thing. They have, picnics and barbecues. They try to make it like a neat place, a place where you want to go.
Yeah.
And of course it's all set up like a grocery store. But it's in the US we have a problem where it's the people who are working. People have an income, they just don't have quite enough of an income. So it gives them back their dignity to be able to use the money that they earn to buy the food that they need.
I think,
But there's just small examples of that, I think, happening here.
yeah, I know WSCAH is just starting a pilot and it's through a federal CDC grant with one of the sort of online grocery companies, right? To say like, look, we're going to pick out a zip code in northern Manhattan and say we're going to find roughly 200 of our families that are from this sub-census zip code, sub-census tract. And we're going to link them up with a specific online grocery platform. And with that, they're going to be able to go to certain stores virtually, and they will have money put on an account in that store. And they will be able to use that money to buy food at that grocery store. At the same time, they are all people who are SNAP eligible, so they will be able to use their SNAP dollars at that grocery store for home delivery of groceries. And part of the pilot is that all delivery and admin fees that would be associated with these online grocers is waived. So you're going to be able to see what people will purchase with these dollars. And they have unlimited deliveries, right? So you're like, oh, do you want to just buy $10 worth of groceries today and then tomorrow? And then you might have a little bit of extra dollars of your own discretionary money that you'll add into it to purchase. And you could imagine, fast forward this, that you give options related to sliding scale pricing. Right? Why wouldn't grocers want to capture this business? Right? That's, this is part of the business model, right? Like I want all the SNAP customers in my community. I want the WIC customers in my community shopping. I want the customer who wants to pay 50 cents on the dollar. Like they want to that's how businesses stay afloat. So you find these smaller grocers who are a bit more flexible. And we think this is also how you get customers, right, to be able to get what they need, which is the same conveniences and dignity that people with means have. Home delivered groceries, choice of all the products, coupons that are delivered to your door, ease of operations related to getting your benefits, whether it's SNAP or WIC. This is the future is here. It's funny because if you go backwards, I remember visiting a few WIC only stores in Chicago that Catholic Charities, I think, still runs. And they were kind of incredible, right? Like you knew you could maximize your WIC dollars in this store. It was a small store. They also had childcare when you were there. You could get an eye exam. There was like all these supports, and it took away the stigma as well because you're like, yeah, we're all shopping for our kids. So I think finding ways to mainstream and streamline these things is really important.
Can I just I think there's another wider issue here. Certainly in the UK, school meals, food in the workplace, and our school meals is still the jewel in our crown. It's in free fall at the moment, but the Mayor of London has extended free school meals and paid and giving extra money for all primary schools across the board to get free school meals. The universalism takes away the stigma because then people are not thinking, oh, that person's in this queue, I'm in this queue, etc., etc. Unfortunately, the uplift he's given is not enough necessarily to meet the nutrition standards. That's the problem because food prices have gone up. But there are other programs such as school meals, and on the continent, a lot of governments on the European continent and in Brazil, South America, what's called the ticket system for people at work. Employers get a tax break for feeding people or giving them a ticket to go down to the local restaurant and eat at the local restaurant, which encourages the circular economy again. So there are those other initiatives, I think, that will develop in the near future. I mean, the irony is, if you think of feeding at work, the big companies do it. The Googles, the Amazons feed their chief executives and their all their staff at work, not necessarily the workers in their warehouses, but and the people we really need to be feeding, we're not feeding. But I think that's a future, because the industry, Greg reminded me, the industry are interested in this because they can provide meals at, reasonable price, and employers get a tax break on that. I put a link into a real meal deal in the UK, which we're trying to reinitiate in the UK, but it's known as the ticket system on the European continent and in Brazil. It feeds 10 million people. And the advantage of that is you feed kids, you've given them at least one meal. Parents have less to worry about because they know that kids have got at least one good meal.
Yeah, I'd say the school meals, especially in New York City, is a great example of this, right? Like we have universal meals. Like, my daughter goes to a public school, an amazing public school in Washington Heights, and she gets lunch and the kids get lunch and no one's questioning what kid is getting what. And you peg the number of meals, right, that the schools or the district gets based on the number of kids in need. And so you translate that to the summer, and the uptick is less because kids aren't in school. And so the smart thing they did in the pandemic that we're continuing now is, so then let's just give people the cash. Like back to Martin, what you said earlier, like it's about cash. Give families the cash to buy food for their families, because either if you have them in a congregate setting, like in school, great, let's make it completely dignified and give everyone the same thing. And that's great for kids to see that and be a part of that. And on the flip side, if they're not at school, make sure they have the cash so that the families can also maximize the same federal benefit. Like a city is spending money, federal dollars, to buy food through the local economy at a school level, and in the summer, the parental level, they're doing it. Like both things maximize dollars into the economy. And I think we keep forgetting about this. Like these programs are not handouts. They're like hand-ups for industry that we should be proud of, because it's actually helping jobs and all these things. And we're so focused on the consumer, as in the customer, and blaming that person when it's like they're actually helping the economy. But I think this
We
is
had a problem with that in the UK when our lockdown happened. Initially, what the government started doing was giving out food parcels. And it takes up Chris's point. I mean, okay, so there was a register of people in need, but many people in work were in need, but they weren't on registers of at risk. So they suffered because they didn't get an uplift or a food parcel. And there was major problems with the distribution. It was given to a commercial company who the whole system just fell apart. But it takes up the point that many people who are food insecure are temporary. They're not necessarily all the time food insecure. And we missed those because we hadn't records of them. And of course, they didn't turn up at food banks, or they didn't give their names. Or if they did, maybe they give different names. The records of the food banks weren't sufficient to track them down because we had a name and maybe the first two letters of a postcode, but not anything more.
One thing that was really interesting to me when I started covering this sector was the idea that in the way it is in the US, we have a set of food banks, and they sort of act as warehouses to get the food out to this sort of retail level of food pantries. There's about 300 to 400 food banks, and they're servicing I think the number is 30,000 food pantries that are all over the country. But a lot of times these food pantries, which are the direct line to the consumer need, they are located in places where the neediest people are not located, right? It's often in a church. It's probably a church in a relatively wealthy neighborhood because you have people there that can contribute food to the food pantry. They have time to volunteer there. So the poorer neighborhoods, the more under-resourced neighborhoods where the need really is higher, there's fewer pantries. There's less access to the food. And I think that's, so what's happening, would you say, in our different, in the US or the UK, to actually find the people who really need the food, rather than putting it in places where the need is not as high.
Yeah, I think that's where we've
Yeah.
totally followed some of these other models like summer meals actually, which is don't think about bringing people to food, bring food to people, right? This is the same with groceries, right? Like, why are you making people come to the grocery store when we can warehouse it cheaper and then send it to someone's home? And so what we do is we find great community partners, organizations, whether they're doing workforce or senior centers, HIV clinic, whoever is doing great work in the community who has a set of customers in need. If we can be the link related to the food, we're going to sort of help make that link and bring that food into the community. And then even further, if we can, as we're doing with New York Presbyterian, when a customer client shows up at a hospital, screens positive for food insecurity, and they're a new mom or they're a senior, we're getting linked to them, and then we're lining up to deliver them those groceries to their door, right? Let's get food to where people literally live. It's not even the neighborhood. Let's bring it to people's door, because that's how a lot of people are getting their groceries, and that saves people time, and time is really important. Whether someone wants to read a book, babysit their grandkids, go for a jog, whatever it is that they use their time for, people should have control over that time. And I think we're seeing more and more the importance of that for people.
I mean, it's similar here to what you said. I mean, they're not getting into the areas where they're needed, partially because volunteers don't want to go there, the facilities aren't there. But we had, prior to 2008, we had a Labour government who were investing in communities and building communities, and food and food insecurity wasn't a major part of that. It was a fallout from it, but it was mainly on children's health. That was it. They had set up centers called Sure Start centers, and food was a big part of it, but food insecurity wasn't the major drive. But it addressed food insecurity because it went to where people were, and it dealt with their needs, which were largely around children. Although I think we shouldn't forget the elderly. Our food insecurity is rising among the elderly for various complicated reasons. And that's not been true for 10 years because they've been protected under social protection measures. But now their figures are rising. But we've got to go back to where people are, linked to communities. And why shouldn't everybody have in a community which is deprived? Why shouldn't they have what everybody else have? I mean, that's the argument. I'm critic of supermarkets, but when I go to low-income communities, to say, well, we just want a supermarket like everybody else, a local supermarket.
Yeah. We do have some questions in the chat.
Okay.
And this is one for you, Martin, specifically about the ways that social support for food access has changed or declined, perhaps, in the UK over the last decade. Can you comment on that at all, that history there?
Yeah. I mean, our social protection did have an element of food in it, but around 2008, 2010, we had a coalition government which withdrew a specific food measure in benefits. So there's no standards for what no nutrition or food standards for what is dangerous or what you fall below and then you require help. We did have that previously to 2010, 2012. Essentially, the responsibility for food has been offloaded to the food bank movement. And government are not taking responsibility. So if you go to a welfare office and you say, I haven't got enough food, you will get a referral to the food banks, to a food charity of some sort. They're not all food banks. You might end up at a Gurdwara, Sikh Gurdwara. You might end up at a Muslim food bank, depending where you are, but there are different options. But the government will now not give you money directly for food. They will refer you to one of the charities. That's what's happened about access.
I want to give you guys the opportunity to say whatever you haven't been able to say yet that you think needs to be out there in our last few minutes. Anything that you want to make sure that our audience knows about hunger relief in these two different countries?
Okay, I would the UK has we have a devolved system, a bit like states. We have Northern Ireland, Scotland, and Wales have certain devolved powers um, on their food, and Scotland is doing some good work. Some of the work has been stymied because of the political situation. We're about to go into an election. There's been a new leader in Scotland, but they've introduced a new bill, which is in the future, there will be no new growth of food banks. Not that we're going to do away with food banks, but people will be able to afford a healthy meal, and they've set this as a standard. And they're going to appoint a food czar, I use the word loosely, to monitor this. They haven't done it yet. But the bill has gone through the Scottish Parliament. I think it's a model we're trying to implement throughout the rest of the UK. About food banks will always be there, but we've got to stop the growth of them because this is not dignified. I mean, and they've based it on a dignity and rights approach. And I would say we've all got a campaign for that.
Yeah, we didn't get into the food as a human right. That's a whole other area. Greg, anything to wrap up?
Yeah, no, I mean, I'm lucky enough to have spent time living in the UK and maybe right at that shift, right? I was there 2008 to 2011 when things were really shifting in somewhat of a negative direction, even though I was working for the city, and still felt like there was a much deeper safety net than we have in the US. And so we continue to push here, right? The same thing, not to expand the network of food banks and food pantries, but to expand an actual safety net. And so I think we have to keep remembering that push and the spend and the time on advocacy and engaging with elected officials and pushing them and not accepting the status quo, because we've been at it for, back to emergency, right? Like emergencies don't last 45 years. WSCAH's been around 45 years. Like that's just epic failure, right? And so we have to hold people accountable, ourselves and our electeds, and further up the food chain, no pun intended. And the person we don't hold accountable, truthfully, is what we shouldn't, is our customers who have the greatest struggle and who are doing the hardest work of all, which is trying to provide for their families when they don't have the means. So I appreciate you both, Martin and Chris, for spending some time together on this and having a chance to talk at sort of a higher level on some of these issues. I'm going to keep diving into the book further and some of the other chapters I haven't read yet. And thanks everyone for joining us today to listen in. We'll send out the recording shortly after we get the full recording of it. But I just want to thank everyone. And once again, if there's a link we'll put the link in the follow-up email to the edited book that Martin put together, and also to Food Bank News that, WSCAH is a partner of, and we're super excited to always be reading. Our whole team's always reading Food Bank News. So thanks everyone for being here today, and have a great weekend.
Thank you, everybody. And we're just dead jealous of Wick and Snap. We want Wick and Snap. We want Wick and Snap. That's our new motto.